verbal fluency in aging and dementia. This study was conducted to compare the verbal fluency of normal elderly people and elderly people with mild or moderate to severe senile dementia of the Alzheimer's type. Verbal fluency is defined as our ability to retrieve elements or members belonging to a specified category within a limited time period. The theoretical framework was based on two types of fluency tasks, one being the Thurstone type task, which requires giving or listing words that begin with a specified letter, and the other task is an animal naming task, which requires listing names of animals.
The purpose of the present investigation was to examine verbal fluency on a Thurstone type task and on an animal naming task in institutionalized normal elderly and in patients in two stages of senile dementia of the Alzheimer's type, mild SDAT and moderate to severe SDAT, because clinical observations have suggested that patients with SDAT have word-finding difficulty. Normal elderly would retrieve more words in the animal naming task than in the Thurstone type task. The patients with mild SDAT were thought to have word-finding difficulty. Thus, it was hypothesized that these patients would show deficits in verbal fluency compared with normal elderly. Since word-finding difficulty should affect both tasks equally, the mild SDAT patients were expected to show the same performance differential between tasks as the normal elderly, since the moderate to severe SDAT patients have additional language impairments, i.e. semantic and phonemic articulatory disturbances. These patients were expected to show impaired verbal fluency relative to the mild SDAT patients. It was also expected that the moderate to severe SDA patients would perform equally poorly on both tasks, since semantic disturbances should disrupt animal naming, which is a task dependent upon word meaning. The experimental methods they used was within subjects. How it worked was there were 30 residents of a nursing home in New York City. An equal number of subjects were assigned to each of three groups on the basis of their error scores on Folt's 33-point adaptation of the information memory concentration test. The normal elderly group had scores less than 10. The mild SDAT group had scores ranging from 11 to 19. The moderate to severe SDAT group had scores ranging from 13 to 20. Evident SDAT was based upon review of each patient's medical record, which induced significant medical and social history prior to and subsequent to admission of the home, in conjunction with each patient's modified ischemic score. The first explanation lies in the proposed synaitic symbolic distinction between the task in which word meaning is thought to be irrelevant or suppressed to the CFL word task. Since subjects in the study use semantic categories as a retrieval strategy in the CFL word task, this explanation is untenable. The second explanation is that the larger the category size, the greater the response latency. Since there are more CFL words than animal names, the retrieval of more animal names than CFL words in interval 1 is consistent with the explanation. However, if latency were greater in the CFL words task, then CFL word retrieval in later intervals should increase. Since CFL word retrieval declined after interval 1, this explanation is not supported. The third explanation lies in Horn's comparison of categories. Although the data is inconsistent with this analysis, i.e. retrieval from a narrowly defined category was better than retrieval from different logical categories, this analysis includes only gross differences between categories and ignores possible retriever strategies that might be used. The fourth explanation proposed here is that the hierarchical organization and the different internal structures of the categories used in the present study influence retrieval. The hierarchical organization among categories appears as supersets of a given category, the category itself and subsets of the category. The internal structure of semantic categories consists of a core meaning composed of the clearest cases or best examples of that category, which are the most frequently given members of this. Inspection of the data from the present study indicates that animal names have many members that are best examples, while the category of words beginning with a specified letter have few, if any, such members.
The author's findings mean that verbal fluency is weakened and or damaged in elders who are experiencing the early stages of senile dementia of Alzheimer's type. and continues to decrease as the disease progresses. Normal elderly performed well on both the Thurstone task and animal naming task, positively contributing to their overall verbal fluency score. As individuals age, there is a risk of developing different types of diseases, such as Alzheimer's disease, which causes a decline in verbal fluency or the ability to retrieve words from memory. If an individual's verbal fluency were to decrease, they would struggle with word finding and retrieval, causing difficulty when communicating.